I have chronic thromboembolic pulmonary hypertension, which in layman's terms means that I have blood clots on the lungs, which makes it very difficult for the heart to pump blood through the constricted arteries. About 2 years after I originally felt the symptoms, it basically went undiagnosed, well, in actual fact, misdiagnosed for 2 years. So I was being treated for things like emphysema, and therefore my condition deteriorated fairly quickly, until eventually I managed to get to the right specialist who said, I think you have CTEPH. The only option was surgery. And I suppose you might say I was at least lucky to have a form of pulmonary hypertension that could be, not exactly cured, but very much alleviated by surgery. When I was diagnosed with pulmonary hypertension, it wasn't just me who was suffering. As my condition deteriorated, then I was able to do less things at home. Difficult to make the bed in the morning, for example. Toward the end, it was difficult for me to tie shoelaces. Luckily, I was married, or still am married, and I had a wife who helped me through this. So this also affects caregivers very, very much.
I was diagnosed 14.5 years ago. I was feeling really short of breath, and when I went to my rheumatologist, I told him I was very active in sports and now I could barely make it up the ferry stairs. And he felt the pulse on my neck and said, you need an echo before you fall through the cracks. Looking at the echocardiogram, they were quite sure I had pulmonary hypertension. It causes me a lot of fatigue. I can't exert myself. I don't do a lot of heavy things around the house.
Caregiver helps any PH patient with everyday life, whether it's cooking, cleaning, anything in assistance that she needs. It's kind of stressful sometimes because you don't know from day to day if she's having a good day or a bad day, and you don't know where the initial outcome is going to be.
It's definitely scary. She manages it really well, and we talk about it as a family, but there's a lot of hope and there's a lot of support. And my mom is a long-term survivor. It's been almost 15 years and she's still going strong.
PH doesn't affect one stratum of society. It can affect anyone from babies to quite elderly, middle-aged, male or female. It will strike where it does. It may be rare, but it strikes where it does.
During a routine exam, our daughter's pediatrician detected a heart murmur. It's medicine time. We thought an EKG would confirm that we had nothing to worry about, but we were shocked by a diagnosis of pulmonary hypertension. Good girl, go back to sleep. We had never heard of PH before.
Saturday morning should start with colors and playtime, not medicine time.
PH is also known as the invisible disease because if you're walking down the street, you don't look as though you're ill, and people are not going to recognize that you're ill. Not that we want sympathy, but certainly there has to be the realization that there is a real problem.
In the span of 4 years, I went from taking oral medications to manage my pulmonary hypertension to receiving a continuously infused IV treatment. And now at 31 years old, I am on the double lung transplant list. I hear it all the time. You don't look sick. It's one thing to deal with the physical symptoms of PH, but because I don't look sick, I also have to deal with that. People don't understand what it means to live with PH because they can't see it.
I believe that a certain self-advocacy is also important. The advice I would give to someone suffering from symptoms of PH is to see their family doctor immediately, because the earliest the diagnosis is made, then the sooner you will be able to get treatment.
Scene 1, Apple, take 1.